best reason to get the hell out of here, you guys have heard too much out of me. And one of the things that I was so happy about this year is that we have some new presenters, including one, Dr. Marc Berger, who I know is out there every day, boots on the ground, doing exactly what we all do. So, Marc, let us know what's up.
Okay, sorry, I have two different presentations. My disclosure is I'm a Slytherin by heart, and I like potions, so I'm really into sublingual. Okay, I am a family physician, board certified geriatrician. I'm of Medicare age, and like Bill Clinton, I have never inhaled. I can't say I haven't taken it otherwise. And I am not certified to use medical marijuana, even though I do certify it. Okay, this was started out as a false positive test and is advanced to different things. It is really good high school science level research, okay? It really is. I would love to cooperate and do it fancy. The disclosures, I funded it. I was the subject. I was the researcher, I was the lab technician, I was the IRB. I did it all by me. Plus I bought it, yeah. So, you know, there's a good tradition of foolish doctors doing work on themselves. This is a research poster for initial one. I did present this to the Family Practice, American Academy of Family Practice in their poster session. Nobody answered. I did it in the Florida Academy of Family Practice. Nobody answered. This is out there and you can get a copy of it. But basically it says you can get false positives sometimes with me. Now I've tested false positive because I took pantoprazole once and they accused me of being a druggie. But that's not in there. Okay. Disclosures. Okay, I'm going to give you the results right now. Does urine drug tests for medical marijuana test things other than medical marijuana? Yes, sometimes, and it depends. The dose matters, the time course matters, and other things matter. One of the things I forgot to say, this is, in my opinion, a really good surrogate test to measure bioavailability, dose response, time course, and other things. So if you wanted to see, is your patient doing well with something, you could actually do this protocol. Marijuana is always tested for delta-9 THC acetate, which is, you can read it. That is also the stuff that drug-sniffing dogs are taught to smell. So don't pee. All right, I use 3 different tests. I've got a 4th one cooking out. They are all different. Big difference is the sensitivity. Some tests rate 50 nanograms per milliliter of the metabolite. Some do 20, and one does different ones. So I've used all 3. They're interesting. Almost all of them use the KEMA methodology. It sucks. KEMA is an inverse test. If you see the line, there ain't no dope in there. So it's a very complicated thing. It's unlike most of the others. In a pregnancy test, if it's blue, you're pregnant. In a KEMA test, if you see a band, you do not have marijuana in your urine at a level that is detectable at that time. So that's the, it depends. Is the abstract. I would love to publish this if somebody can help me tune it up. The only thing I detected was time. You take a single dose, single person, single time, and you see when the urine turns positive and when the urine turns negative. It is not like doing the blood test. It is not like doing the gas chromatograph. So again, one dose of CBD, delta-8, or CBN can show up positive some of the times, depending. What's the dose? Most of the time, I dosed it by 1 serving, whatever the 1 serving was, and it does vary. All right. There are real-world situations where people get tested. I have one case later on. There isn't much in the false positive literature, false negative literature. So I've developed a really simple technique, double void multiple times. The times depend on whenever I feel like peeing. So one of the other problems is all these technologies use a monoclonal antibody. Nobody says what the avidity for the monoclonal antibody is to the various chemicals. I used to be an immunologist chemist. The avidity does matter. Will your monoclonal antibody bind THC 5 times more than somebody else's monoclonal antibody? Can't find out. The CBD products have THC levels. I did all my research on full spectrum. The dose that I took is 3 milligrams of THC. So at the dose you can get a lot of THC. CBD in my mind has to be dosed at least 10 times the marijuana dose to get any effect. So it's 1 milligram per kilogram to 10 milligrams per kilogram. So when I prescribe CBD, I usually tell you to get the 5,000 milligrams of hemp extract in the bottle. Same with CBN. CBN, there ain't no CBN in the CBN products. There's about 3 milligrams of CBN in most of the CBN single dose, which has about 30 milligrams of total cannabinoids. Okay. All right. It does get metabolized. The metabolism is done in the liver. First pass effect, if it's oral, it goes in quickly. If it's any other thing, it gets converted much slower. And actually, the first pass gets acetated to the 11-hydroxy turns to be an acetate, and you measure the concentration of acetate. So the leaf has almost no THC in it. So if you were to chew a leaf, you wouldn't get high. You wouldn't test positive much. All right, single subject, single dose administration in a cannabis naive person. I always made sure I tested negative before the things. It was a double voided technique. So you void once, and then a half an hour later, you void again. So during that half hour is the only time you get the excretion, so it's not duration. It's only half an hour's worth of urinary excretion. And unfortunately, I couldn't control for the volume. Depends what I was drinking at the time. It's not blind. I knew what it was. There's an expectation bias, I'm sorry. So the technique, half hour before the test, I urinated void sample, did not usually test it. Half an hour later, midstream urine sample, tested fresh, 10 to 15 second dip according to manufacturers, and then the strip was read under standard lighting conditions in my bathroom. So it's a LED daylight bulb illumination looking for the T and C lines. The C is the control, the C is always positive. The T is the test. If you see a T, there is no THC. Okay. The technique, yeah, it's pretty much the same thing. The results, cannabinoid naive people tested negative. Tap water tested negative. I actually did it. So, positive test points, I really wanted to see adjacent test points. So if you had positive at T 30 minutes, I really wanted to see your positive at T 1 hour. And that always happened. The full spectrum CBD oil, again, the dose I calculated is about 3 milligrams of THC. Now I did do later on some real THC tests because I was in New Jersey where they have recreational. So I played with some of that stuff, and I'll show you that. So the recreational depends whether you test positive. Really, there are tons of variables. So at a very low dose, the sublingual low dose THC marijuana oil from a certain dispensary that's here in New Jersey never did positive on me. I didn't feel stoned. I didn't get high. There wasn't enough stuff. Same thing with the quarter gummy. Just didn't do anything, didn't show up. This is sort of the expected pharmacokinetics. At time 0, you have nothing. Nah. Okay, at time 1 and time 2, you have positive. How long the time 1 and time 2, to some extent, determines your bioavailability. How much of the stuff did you get into your body that you can metabolize? Time 3, you're beginning to lose it. Time 4, it's all gone. Time 5, there's nothing. And what I did really is determine what those times are for different products. Okay, so this is what the data looks like. It's really boring. The interesting thing is with this particular brand of CBD, I had positive tests 2 times in a row at 7 hours and at 13 hours, and after that it was gone. So if you test people at the wrong time, you won't get it. You test it about 8 hours after a high dose of CBD, they'll test false positive. Okay, these are the test kits I used. I didn't use a brand name drug test kit yet. It's most expensive. These things run from $1 to $5 a test, so they're dirt cheap. They are all CLIA waived. They are over the counter. I bought most of mine on Amazon. And this is what some of the test strips look like. They're all chemo methodology. And I can't get the laser pointer to work. Okay, so the T thing can be clearly seen. This one here, I believe, is a 20 nanogram sensitivity. The one above it is a 50 nanogram. So these have no THC, so you can see that little itty bitty T band. This one almost has THC. But again, it's really tricky. Did the band show up or not? Okay. Now, this is a reference lab published data. This is sort of interesting. This is their particular monoclonal antibody. And you could see it detected delta 8 metabolism the same as delta 9, but the non-metabolized stuff still got tested at about 2 orders of magnitude less. But look, they also tested cannabinol the same as delta 8. And, cannabinol, but cannabidiol got tested less. And there's a thing with the oxidation and the double bonds and whether it's aromatized. So you can see that with a commercial lab, real CBD should almost never be detected. Maybe, but THC, delta 8, acetate, delta 8, delta 9 acetate, the metabolites your body pees out, excretes, detected at a fairly good level. They're 50 nanograms per mil. This is what the lab said how to do it. They claim a false positive rate of about 4%. And again, this is one of the researchers, CBD, negative at time 0, positive at 4 hours, positive at 7.5 hours, gone at 8 hours. Oh, we went over that, the kinetic. This was a lousy thing. So this is me, blind. The liver cytochrome P450 does matter a lot for the 11-hydroxy. I am not abnormal for that. So I do have 2D6, 2D9 slow metabolizer, but that doesn't affect marijuana. Proof of concept study, real world simulation, 1 serving of drug, not very scientific, but interesting. If it does work, it works at least some of the time. Now, how many times, I don't know, because I don't have double blinds. So this is the first real thing, high-dose sublingual hemp oil, 1 serving. And again, positive at 7.5 hours. There is a 5-strep semi-qualitative, which I didn't show here. So I could test with the 5-strip and see that at the sensitivity of 200, it was negative, but at the sensitivity of 50, 20, and even 15, it picked up the drug. So this is semi-quantitative. And there was one point where the 50 was negative, but the 20 was positive. That's where I got my semi-quantitative. And it's the next one down. Okay, so again, this is the semi-quantitative time course with the 5-strip. Not particularly important, other than it shows that it really does work. During time, you pee out less of the active metabolite. Okay. So again, this is now the early study with 1 dose of CBN at the company that I use, CBN ampules, sublingual, as directed, 1 dropper, never positive. With 2 droppers, positive some of the time. 2 of the data points. With the high dose CBN, it was positive a little more. Then I started getting some real marijuana stuff. A 2.5 milligram gummy, now it's a gummy, that's not a sublingual. So that was positive for 5 days, single dose. So you take 1 gummy, you're gonna be busted for 5 days. A company's Delta 8 tincture, again, 1 serving, 1 dropper full, positive for 6 days. Now, subjectively, with that, I really didn't feel particularly high. So, I estimate Delta 8 is about 1/3 as potent as Delta 9.
I salute you for the risk of even trying it.
It's a fun experiment. I did lots of fun things. Also new, brand new, I took a THC-infused seltzer. I bought it in my bar. And I chugged it down and I checked it. It was positive at 1 hour. The subjective experience, I felt a little dopey at 15 minutes. The dopey was really strong at 45 minutes and was gone. From the negativity, this stuff is behaving sort of like sublingual, the time course. So again, with this technique, you might be able to actually measure how strong it is, how long it lasts, how quickly it starts, and how long you're busted for. So the seltzer is much more potent than a gummy. And I think it's because of the carbon dioxide bubbles in the seltzer. It makes it absorb faster. So you get higher quickly. The seltzer, I believe, is very dangerous. It's medicinal. Some kid goes to the bar, 18 years old, chugs 3 seltzers in a row, goes home and drives. He doesn't feel it. Half an hour later, he's stoned out of his mind. So it's dangerous for impaired driving and impaired things. I can't measure impairment. I can just measure how you're peeing it out. This is a CBN ampule. Again, it was gone in 2 hours. So if you take your CBN at night, when you wake up, you ain't going to test positive. The Delta 8 stuff lasted forever. I gave up on it after a week. It hit fairly quickly. It hit within 1 hour, but not within half an hour. And again, when you absorb it, you still may get the effect long before your kidneys and your liver have metabolized and excreted it in the urine sample. So you've got a delay. Delta 8 sublingual should hit in 15 minutes, but it didn't show up at half an hour, but it did show up at 1 hour. And then it stayed positive forever. This was another product, the Delta 9 THC. There wasn't enough Delta 9 in the product to detect it. They rated it as 3 milligrams of CBN, 15 milligrams of CBD, 20 milligrams of hemp extract, 1 milligram of Delta 9 THC in there. Again, I found at least in me, 1 milligram ain't enough to detect it. I need 3 milligrams of THC to pick up a false positive or a positive. So CBN tinctures, I did double dose, never positive, with a different company. Then I did Delta 8. Delta 8, again, this is a different company's Delta 8. I couldn't figure out how much it is in there, but it was 0.5 milligram per serving in an ampule, and it popped up positive in 2 hours.
You know, Mark, I think without testing, quite frankly, there may have been more Delta 9 in there, than anybody would know.
But Delta 8,
practically what those products are.
But Delta 8, from the other thing, the antibody detects Delta 8 the same. Sorry. Okay, so Delta 8 positivity curve, I gave up at 7 days. The ultra low dose CD, real THC, a very small amount, sublingual, never positive. It was too low for me. That's the same thing. So again, the results, full spectrum CBD was positive between 2 and 6 hours after you ingested 1 serving. normal dose of CBN not positive, double dose positive. The company I use recommended after 4 days to take double dose, take 2 ampules together. THC gummies, positive for a long time at a higher dose, lower dose. The seltzer was positive for 2 days. So if you're going to chug a seltzer, again, you're going to be busted. That's in there. These are actually the products I used. That's the cannabis-infused mocktail I used. It does not taste good. And I did a chug technique where I finished the whole thing in 15 minutes, which is probably what people will do rather than a sip over 2 hours, because it's basically sort of imitation beer. It costs between $8 and $12 a can. Some cans are rated at 10 milligrams of THC. Some cans are rated at 5 milligrams, 0.3% THC by volume, and they sell it as legal because it's hemp-derived. Okay, and then there's the seltzer stuff. Lots of biases on this. It's biased. It's junk science. So again, I think this might be a good surrogate. You have somebody, you want to know what their bioavailability is. How long do they pee out a single dose? You want to see how quickly it works. How soon do they take false positive? If you want to confirm it with gas chromatograph or blood levels, go right ahead. I couldn't afford to do it. So again, same thing. Lots of things I'd like to do. Try broad spectrum CBD instead of full spectrum. Oh, this is one of the cases I had. A VA patient tested false positive for the drug.
You got 1 minute to tell us.
Oh, I got the other one. Okay. All right. The other one, I'm asking for people to help me on another research study, which I call MAFLIPS. My theory is fibromyalgia is the same as long COVID. So there is some CBD for fibromyalgia research going on. Again, the dose is much higher. You're in the 100 milligrams to 5,000 milligrams. So I wanted to see if medical marijuana at a reasonable dose will make people with long COVID feel better. I haven't proved this. I will bet incredibly money it will. Because as I say, if you're a little bit medical marijuana, you're not going to notice the symptoms. So I would love to get some people to help me. The protocol I have is fairly simple, 40-person, because of I didn't have it in there. I invented a new word, SERPE, symptom affected, I forgot it now. My theory is if you can detect the side effects of the active drug, it will work better than the placebo if it has no side effects. So on a study, marijuana study, if you're taking placebo, you know you don't have the real thing. It ain't going to work. You're taking real marijuana, you're going to get high or a little bit stoned or marijuana mellow. You're going to think it works because it's a study and it's going to work better. In the crossover study, I have a problem in that the crossover is which drug you take first. I'm telling you, half the study you're taking marijuana and half the study you're taking placebo. And you're going to know within one dose. So my prediction is the people who start with the placebo won't get as high a placebo effect. The dose effect won't be as high as the people who start with medical marijuana. And when the medical marijuana people are crossed over to the placebo, the positive effect will disappear. And I propose to test 8 different things, some negative, some positive, biologically plausible. I don't think medical marijuana is going to do anything for the respiratory problem, but I think it's going to work for the sleep, the anxiety, the nervousness, the pain, all the fibromyalgia symptoms. Oh, what did I go backwards?
Can't. Must move forwards. This we got to preserve Dr.
Yeah.
Frosch's
Okay.
time.
So really, that's it. That's the crossover study. This is the proposal. I've got this here. It's out in the poster. If anybody wants to join me in doing this, I don't need much. My estimate is $2,000 a data point. I need 2 doctors and a research assistant, and I'm going to buy the drugs from a standard company. Thank you.
Awesome. Yeah, the